My name is Dr. Lauren Snedeker. I am the coordinator for the MSW Certificate in Aging and Health here at the School of Social Work, if you do not know me. If you're not familiar with the certificate and the opportunities that exist, please feel free to look at the document that I will drop shortly in the chat that explains the certificate program. We also have a certificate forum if you're a student interested in certificates. We have an event on Monday, October 26th at 4:30, and that will be accessible through the Student Affairs website. I also want to give a quick shout out to my fabulous intern, Joe Bastian, if you can give a wave. He has been instrumental. He's an intern with the certificate program, and he has assisted greatly with the construction of this event. And we'll hear from him a little bit later. He will be helping ask some of the panelists the good questions that we came up with. So, Zach, I just want to make sure, sorry, you're admitting people. Okay, good. So I'm pleased to be hosting this very important discussion on the ways that COVID-19 has and continues to impact older people in their communities, as most of us know. Today, we have a great panel of social work experts who will be sharing their experiences from the front lines. I'm going to introduce them now, and then we'll just go right into the questions so they can share their experiences. So as I introduce the speakers, if you don't mind just giving a wave in our new virtual environment. That's how we'll know you. We also have names, but you know, it's good to say hello. Rebecca Abenante is the Healthy Aging Coordinator at Atlantic Health System. Rebecca, if you don't mind giving a wave. And she's also an adjunct professor at William Patterson University teaching about social gerontology. Last but not least, Rebecca is an alumna of our certificate program. So if you're in the certificate program, you can kind of envision a career pathway for yourself. So welcome, Rebecca. Next, we have Christine Newman, also an alum, and thank you, Christine, currently serving as the Director of Community Outreach and Volunteer Engagement for AARP New Jersey. So welcome, Christine. We next have Marcy Salzberg, if you don't mind waving, Marcy, thank you. She's another great friend to our certificate program and is currently the Director of Social Work and Dementia Services at Parker Health Group, which has several sites, if you're not familiar, that offer care to older adults and their family members, depending on their needs. And lastly, but certainly not least, we have Dr. Robin Wiley. If you could just give a wave, Robin. Thank you, Dr. Robin. She is a clinical practitioner in the field with her own private practice focusing on older people and their family members. And she's also an adjunct professor in our BSW program here at the school and a proud alumna of the DSW program as well, as I am also an alum. So yay, Dr. Robin, welcome back. We can't let you go. So again, welcome to all of our panelists, and thank you so much for sharing your time and experiences with us. I want to just kind of get right into it with asking you all our first question. To all in the audience, if you don't mind just waiting until the end of our discussion, once we get through as many questions as possible, there'll be a total question period, if you will, at the end of the talk. So we'll save time for that. And with the panelists, please feel free to, raise your hand, shout it out. We're kind of informal about this since we're not in person. So, there's no particular order. So the first question that we thought would be helpful for the students and those on the line was for the panelists to share one example of how COVID-19 has impacted your direct work with your client community. It might be hard to just give one example, but I encourage you to do so. We're interested to hear.
I can go ahead and kick us off. Oh, Dr. Wiley, do you want to go first?
Oh gosh, Dr. Robin, I saw you raise your hand first. I'll moderate a little bit more.
I just wanted to share, I know when I saw this, and I did really think about the questions. They were really great questions that you came up with. One of the things I noticed, I've seen like an increase in referrals, not necessarily by older adults themselves, but by their family members, where I've had family members to contact me on behalf of their older adult family member, based on some concerns they had related to, how the increased isolation has impacted them. They see an increase in anxiety, more worry, overall stress, and just in general, just some overall emotional difficulty. So I've found that I've needed to, and also maybe not so much of an openness for their older adult family member to want to participate in therapy, but that the need was there. So I've definitely seen like an increase there over the past, I would say probably like, 3 or 4 months.
Thank you, Dr. Robin. Absolutely, that makes sense. With all of the mental health considerations and impacts. Yeah, Christine, go ahead.
So a few things I think that come to mind for me, but right off the gate, like everyone else, we had to pretty much reimagine how we deliver resources and information to our members and communities. We went from 100% being in person to 100% virtual, and the implications of that were really having to come up with a tailored strategy to make sure that we could still engage with all the folks that we needed to, understanding that maybe not everyone is as comfortable on certain platforms in certain virtual environments. So, we actually did a lot of work with partners as well to make sure that we could reach outside of just our organic audience that we had in a virtual space, to make sure we could also help support our partners that were working with older adults. We did a few things, including webinars, but we also did teletown halls specifically for older adults that we know we didn't have email addresses for or weren't able to engage in webinars. We actually hosted teletown halls with the state, with our fraud partners, really in the beginning to just get that initial information out to folks about where do you need to turn to for your state-specific resources, who are your issue experts, and helping connect our members and communities to those experts across multiple fields. We also did a postcard, again, thinking about folks that we can't reach through webinars. So we actually mailed out in partnership with the state of New Jersey to folks that, again, we didn't have a way to reach in the virtual space to make sure they could still connect to those resources. So that's sort of, I would say, sort of top line, what we did in the beginning.
I mean, I'll echo a lot of what both Dr. Wiley and Christine have said. I think that, a lot of my role previous to COVID was out in the community, and again, doing a very quick flip to in-person to learning Zoom and trying to teach Zoom to seniors, which was an adventure in and of itself. I think the other piece is trying to help support family caregivers, and trying to, I'm based in an outpatient medical practice that specifically cares for older people, and, really trying to help triage older family members who are trying to care for their loved ones at home, knowing that so many services stopped, or they were afraid to have their home health aides come into the home. Or daycare was shut down and could not go any longer. How do you navigate as a caregiver the practical care on a day-to-day basis, but also the stress and worry and anxiety? I think also, I'm sure, and Marcy can probably allude to this in far more detail, but trying to help families who have loved ones in care facilities and couldn't visit. As well as in a hospital setting, some of the just really overreaching concerns about the risk of this population during a pandemic at the highest. I think we all can remember those days of March and April when kind of every week was just a learning curve, and how we all had to transition and care for ourselves too. So I think it's all changed. Is the long and short answer.
Absolutely.
So taking everyone into the nursing home for a few minutes, we were definitely impacted in many different ways. The first of which, I just want to talk a little bit about, having to get used to wearing personal protective equipment, learning how to put that on. because that's not something that we generally use in nursing homes to the degree that we were using it. I remember when I first started my career in the hospital, I was fit tested for an N95, but we don't do that in the nursing homes because we don't use those. So just that whole piece at the very beginning. And then of course, talking about the shutdown. And at first, the shutdown was accepted and understood, and everyone was agreeing with it and accepting of it, because we were all like, let's stay home, let's keep this safe, let's flatten the curve. That's where everybody's mind was. And I never thought that our residents would be in their rooms for as long as they were. It's only very recently that we've been started to open up just a little bit, or even family members. I also deal with admissions here at Parker, and you know, it's very difficult for families to drop their loved one at the front door, having never seen or stepped foot into our homes. So they have no idea who, what the place looks like. I have family, I remember a family member said to me, it's a good place, right? It's a good place. And I felt very comfortable saying, yes, I do work for an excellent place, but I could just imagine, you know, how she was feeling. So I think our work was tremendously impacted. The whole idea of person-centered care, that had to take a back seat for a little bit. As much as I hate to say that, we were all focused on infection control for a while. And I'm only now starting to work with our leadership and management and starting to talk about bringing person-centered care back in. So there's a lot going on in the nursing homes. Our staff is doing a tremendous job. And also wanted to shout out that our staff needs support too. So definitely a lot going on there.
Thank you all for those answers. Absolutely. I couldn't agree more, Marcy. And we try to discuss this in all of our clinical classes at the school, where it's so important to make a self-care plan now to carry you through school and post-grad. Joe's nodding, maybe a little annoyingly, because I stress this to him every supervision. But we know the importance, because this is what provides us with a safety foundation for when things like this in our world happen. Because they're going to happen, and this is maybe a powerful indication, unfortunate indication, that these types of things will continue to happen in our world. So I thought it was particularly interesting about the shifting in focus, because we always talk in social work on person-centered care, especially with older adults, people living with memory loss, for example, especially, and recognizing the lives that people have lived as our older clients and infusing that into care. And so I think it's really interesting and probably very stressful for our clinicians on the front line, our students as well, to incorporate that while also, delivering care that is informed, with respect to infection control. It's very, very important. Thank you all for sharing. And certainly we can probably have a whole discussion on how COVID-19 has impacted our direct work. But I wanted to shift us to the next question that I have to admit Joe helped craft along with me. In terms of services, what gaps in services for older people do you feel has been especially highlighted by this pandemic? This might be even maybe an opportunity for our students to envision some innovative practice that they can partake in upon graduation. So again, what gaps in services do you feel have been especially highlighted here? And they don't have to be new, they can be tried and true that we consistently talk about. So I invite the panel, and if anyone has a question that they're not going to ask later, don't forget we have a chat.
I think that one of the things that I've noticed so significantly is anything around socialization. So many things just abruptly ended when COVID hit, not only of, how many services were dependent upon volunteers, and volunteers could not do what they had done. And I think that that has become incredibly apparent. Marcy, you talked about how, here we are sitting here in October. I don't think any of us thought that we would be sitting here in October still concerned about people who have been isolated for so long. Mm-hmm. And I think if anything, that just speaks to how important human connection is for our older people, not only in facility settings, but at home, in the hospital. I think one of the things that we, my colleagues in the hospital setting who run our delirium prevention program, that, you rely a lot on volunteers to do bedside interventions to help keep people engaged, is that all the volunteers were no longer allowed in the hospital, and now had to translate into trying to help keep people alert and aware and oriented in a pandemic when very few people could go in a room, if at all. So I think that the social component, and I think also helping to support, I think it's become even more apparent that when the formal system breaks down, meaning the formal services like home care, like adult day services, like transportation, like grocery shopping services, I think there was some places that had some interruption in meal delivery. When those services break down, it's turning oftentimes to families who were just, I think in many ways, caught off guard as to how to actually step in and provide some of these services in the context of the own craziness of their own life. And so I just think there's so many opportunities for us to look into ways to be creative, to say, how do we support people when the formal services can't function?
Such a good point. Dr. Robin.
Yeah, I just wanted to piggyback off of that. I mean, I think that there's definitely something that we see that's needed is, sort of like whether it's protocols, procedures, things that need to be in place for how do we handle this so that, I mean, and of course, this is not anything anybody could have imagined, but, how can those services be put in place? Because if you think about just something as simple as going to the grocery store, it was a while before grocery stores decided, well, let's dedicate a certain time frame for older adults, which legitimately that's something that's probably needed anyway.
Absolutely.
Even before a pandemic, so I mean, unfortunately, from a perspective of aging, we don't necessarily appreciate and respect our older adults as much as we need to in this country. And so one of the things that because a lot of and I know Dr. Lauren knows, like a lot of my work, my research is with the experience of aging. And one of the things where I thought of like a big gap is, and it's going to sound out, but the use of technology. Like we make this assumption that older adults can't use, do not know how to use, have no interest in using tech, but that's simply not true. And during this time, technology use is very, very much, it's extremely significant and needs to be encouraged amongst older adults. And I notice with my own clients that, average anywhere from in their 60s on all the way up to their 90s. And, and yes, they need some assistance with that and kind of how to maneuver, but, there's certainly an ability to learn the tech. And I'm doing sessions with them via Zoom, FaceTime, and so it's needed. And it also helps to decrease some of that isolation. Another thing that we sort of take for granted, the streaming services, Netflix, Hulu, Amazon Prime, whatever. For us, we see that as it's a time filler. So do older adults, even social media. And I'm speaking from some, I have research to back this up, that older adults 80 and up are using these services. However, there is a need for instruction and a lot of times that patience. And so I think what's happened now is that we see that it's more relevant now than at any other time because, and I think from my own personal experience, my father is 81 And, you know, he's calling me and telling me about, did you see this movie on Netflix? Like this recent movie that just came out, you know, so this has provided him with something to look forward to. Because going out, you know, where I think we all took that for granted, is just not something that is feasible. And especially for older adults, because they definitely have an increased amount of stress and anxiety and worry related to, you know, going out or going into a store. So I feel like that, and of course, I will always, you know, get on my soapbox about the need for therapeutic supportive interventions. Like, this is a group of people that we just don't think that they need any type of therapeutic support, whether it's in the form of therapy, groups, what have you. And that's just simply not true. And I think that's come to the forefront even more so now, especially where you think about people in long-term care facilities, or even who live in, you know, supportive housing, like in the community where nobody's coming in on a regular basis, and they're basically isolated to their dwellings. So anybody, you know, I always say to students, you know, let's not think of this as a group that, okay, they don't need services. Like, they do, definitely. And it's a very different experience working with them as a therapist. You know, it changes. I think it helps us to evolve as clinicians, because we do have to do some things. Like, you rethink your process, you rethink different things, that how you would typically be, I guess, or how we think we would typically be as a clinician. You rethink that when you're working with older adults, because a lot of the things that they're impacted by are not going to change. Right. And so we have to be a little bit more creative with the therapeutic process.
Right. Thank you. Thank you, Dr. Robin. Any of the other panelists have?
I just wanted to talk about ageism for a moment. I know, Dr. Wiley, you touched on this, but I think that is definitely a piece here, a gap. How many times do I remember hearing this disease really only affects people who are older? You know, the lack of understanding from the government agencies what our nursing homes needed, the focus solely on the hospitals. And there's good argument to say why that was done, but in the background of all of this, there is this ageism piece going on here, and that is kind of permeating through everything that we're seeing with this response. You know, the closure of the adult day programs, you know, kind of leaving people in the lurch without kind of any other supports. I understand, again, it had to be done, but because ageism is permeating, and I think it affects the fact that we didn't have those secondary, tertiary, and quadruple area, whatever that word is, supports in the background to support them. Word, quad. I don't know. After tertiary, I don't know what the other word is. One of the students wants to tell me.
We're not math people. We're social workers. All right. Yes, I couldn't agree more. I think Christine also has something to piggyback off of that.
Yeah. I would just say, you know, and I agree with what Marcy and everyone else has said. And specifically, I think one of the things that this pandemic really brought more attention to is some things we've known for a while, and some new things in terms of how we need to do a better job supporting our staff and residents in long-term care settings. You know, when we have 50% of COVID-19 deaths in our state that happened in long-term care settings. So, you know, and I think there's some movement at the state level on this. You know, we had the Manat Health report that came out that had, you know, a review and then some actionable items for what the state can do to reduce the impact of future COVID-19 outbreaks in our long-term care settings. So, you know, we have this package of 11 bills that have been working their way through the Senate and the Assembly. Several have gone to the governor, and he signed them around things like exactly this, like putting together a task force to look at long-term care quality and safety, you know, looking to increase preparedness in emergency responses during an infectious disease outbreak. So how, you know, making sure that there's appropriate levels of PPE. And then also one of those bills specifically looks at this new sort of realm of virtual visitation, right? When we had to shift to infection control as the primary focus, how do we make sure that there's still opportunities for virtual visitation for families and loved ones? And then on top of that, another one of these bills that is also signed by the governor is focusing on ratios for direct care staff in long-term care settings, as well as minimum wage settings. How are we making sure that the folks that are on the front lines protecting our families, our loved ones, are paid a living wage? And again, things we've known for a while, but this pandemic really has kind of brought to the forefront.
Exactly. I'm not sure, Rebecca, you spoke.
I just wanted to add something that Christine said. Just for one of the bright spots of this pandemic is that for the first time ever, the role of the essential caregiver was not only noticed, but it was honored, respected, revered. I mean, we started calling people heroes. So I think that was really a bright spot here that would not have come out had it not been for the pandemic. So sometimes I like to think about what are some of the positives that have come out of all of this too.
Absolutely. And I couldn't agree more that the attention needs to be paid and honored to those working in that direct care, of which social workers are side by side on the team with. And investing in their well-being will only be the best investment in your loved one or family member. I like to say not so loved one, because let's be real, but in the people that are being cared for in their lives. So if we're happy to do our job, we will do our job well. And that really makes sense. It's pretty clear. So I think panelists are good on this question. Yeah. Okay. Joe, I'll invite you to ask the last two questions we have.
To kind of piggyback off of what we were just talking about, what are some unique ways that you've run into for families, clients, organizations to foster connection and kind of reduce isolation among older adults during this time?
Alexa and Google. I hope nobody's stuff went off as I said that.
I know.
I just did.
At first I was like, oh my gosh, not another embarrassing moment.
So the A word or the G word, I have to say there's been so many families that have been not only looking at these devices in terms of monitoring home safety, but also I've heard from so many seniors that are kind of really who never probably would have embraced the technology before this are kind of saying, all right, I can sort of see how this might help me in my day-to-day. I think also looking at the devices that are geared towards seniors, like the GrandPad is one brand, and the much more simplified devices. But they're sort of, I feel like having a moment that hopefully the momentum will continue, because I think it's been a really great way just to not only connect with family and friends virtually from a long distance, but also, just that engagement and the goofy stuff that I think younger generations, we're more used to, the tell me a joke and the other silly stuff. But, that connection. I can tell you, in my own personal life, we had my parents' 50th wedding anniversary through Zoom. And it was probably, although not face to face, one of the coolest experiences, because it was all their cohort of people in their 70s from across the country that we were able to get together. And some of them learned how to do Zoom just for that. And I thought it was the coolest thing to be able to bring people together. But definitely the more these devices. And I had someone recently that was trying to circumvent and figure out a way to utilize long story short, they, instead of using a traditional pendant type of medical alert system, they wanted it so their spouse would be able to call his wife's cell phone if he needed something, as opposed to pressing a button. And we sort of brainstormed, and she ended up wanting to put the little A dots all around the house as an alternative to the medical alert system.
Right.
So again, trying to be creative, but I think that a lot of these devices are coming out and offering opportunity to do that.
Yeah, I gotta say, I think one of the positives that has come out of this is it's sort of that old adage, necessity is the mother of all invention. But the amount of innovation and creativity that we've also seen during this has been really encouraging. You know, one of the programs that I work with a lot in our state is the network of age-friendly communities. And some of the communities that we work with, the programming that they've put in place, the support and resources very quickly that folks have pivoted to. You know, a couple examples that come to mind for me are in Flemington, there's the Family Harvest Success Center, which put together a Cooks and Books program. So it was taking this idea of a food pantry with senior hours and upping that game a little bit to also allow an opportunity for folks to have a book exchange, you know, have a little bit of a social interaction while they're getting their food safely. Another one that really comes to mind is Garfield, who's in our age-friendly network. Garfield has a very large senior building in town, and they all have balconies, and they actually arranged balcony Zumba and exercise classes. So they would have they'd have an instructor down, you know, in the courtyard with speakers, and you would just look up and you would see all the residents out on their balconies. So again, able to still have that social interaction, also some healthy active living components, but, you know, just things that folks sort of on the dime said, you know what, we've got to make it work, right? We're there to deliver for our constituents, for our residents. How do we make it happen? And I think that there's been a lot of examples like that, especially in our field. It's been really interesting to see.
Absolutely.
I would agree. I think that just the use of how people just use technology, I think that's been certainly the best way. You know, and I agree, you know, with Rebecca, that older adults have now become like a little bit more open, because they are realizing like, oh, wait a minute, you know, this is a way, you know, for us to stay connected or just get other information or just to pass time by being on the computer, looking on the internet, that type of thing. But I do agree that the speaker type of services, because I don't want to say either, but they have definitely been embraced by older adults a bit more. I know one of the things that I've been sort of, when I talk to families that are, you know, kind of talking to me about their older adult family members, whether they are existing clients or they're referring their family members, is about the idea of, you know, checking in and reaching out intentionally. Because I think, you know, having a consistent pattern of keeping in contact with their older family member is so important now. Because before it could have been hit or miss, because there were other people that their family member was possibly seeing, whether it's an aide that's coming in, whether it's volunteers, whether, you know, they were going different places or what have you, and just setting up days and times where they are reaching out, whether it's, you know, through a socially distant visit, or whether it's, you know, via Zoom or FaceTime or what have you. And I think that's just been something that, even though it's, you know, it's not so much a unique way, but I think family members have realized, you know, how much more important that is now. But the idea of doing it in an intentional way and not just like, oh, you know, and I haven't talked to them in like, you know, a couple of weeks or whatever, so let me just reach out and see how they're doing. You know, because that's always been important, I think, and that's always something that older adults, I know when they've talked about things that they wish would happen a little bit more, it is about seeing their kids and their grandkids.
Right.
So yeah.
Thank you.
I think there's been, due to everyone going on to Zoom and everything, there's been an increased availability of spiritual pursuits. So, you know, I know for people that want to attend church services or things like that, obviously we're not doing it in person, but there's so many avenues to now be able to attend that online for all religions. And that's something that didn't exist before. So, you know, if that's something that's important to your clients or your residents, that's definitely something that you can now use. And I don't see that going away. You know, I don't think they're going to stop offering that from a virtual perspective. There's so many classes that you could take now. You know, we're all talking about the technology. Couple other things that aren't so techy, but things that we've done in our communities that have gone over really well to keep people connected and engaged. If we have an art project, we'll collect and gather all of the supplies, give everyone instructions on what to do, and then deliver it to their rooms or to their apartments, depending upon which setting we're in. I think it was National Sunflower one day, so we gave everyone a, you know, plant your own sunflower. So we provided all the materials and brought it, and that can be done at home. That could be done, you know, in the nursing home. The other thing that I noticed a lot of happening is these drive-bys. So I've seen them being done at the senior centers. I know in our adult day program, we've done drive-bys where our adult day program has gone out and visited every participant. And then we've also invited them to us, where they, you know, kind of drive by. They had this award ceremony or something that they usually do every year, and they weren't able to do it in the adult day program. So they invited everyone to drive by. So those are some other really creative ways. And I agree with whatever everybody said. It's really nice to see the creativity that is happening and the opportunity to innovate and create something that wasn't there. It's a really exciting time, and I encourage, you know, students to think about these things, because any idea is worth pursuing for sure.
I think that, you know, we also talk about, although it's, you know, there's a piece of it that's isolation, but there's a piece of sort of using all of these different elements of technology is also having access to healthcare. You know, I know that, you know, Dr. Rodman, you were talking about how you're seeing people virtually. I know many of our physicians and us as a practice, you know, trying to help connect with people who were at home, you know, doing virtual and telemedicine. Was also very an interesting concept that I don't necessarily is going to go, it's not necessarily going to go away to some extent. It might look a little bit different in terms of billing and all of that, but it was also very interesting to be able to kind of see into people's homes for the physicians who don't always necessarily get to do that, to be able to kind of evaluate and see what was happening in the environment and be able to, you know, really kind of connect with people in a different way in their home, which I think is, again, you know, we don't always get to do that unless you're in a field that you're able to do home visits, but for people to be able to kind of show off, oh yes, these are the pictures of my grandkids in the back, and, you know, oh, we can have a Zoom kind of telemedicine visit, and we have, you know, the 3 kids that live in 3 different states who are able to be on and be part of that conversation, really was sort of a very interesting opportunity. So, I mean, and there was a social kind of component to that. I remember I think we had one family that said, can you just leave us on here, and the doctor, you can kind of go away, but just leave us on here so we can chat, you know. But again, sort of, it's a brave new world. And as students, I think you have so many opportunities to be creative, because this is the time that innovation is huge in this field, in every field. But, you know, as social workers, you can wear lots of different hats and do lots of very cool things working with this population.
I couldn't agree more, and we all know that. Thank you, panelists. Joe, go ahead.
Yeah, so the last thing is we talk a lot about how to, like, different things we can do to help seniors, but we also know our seniors have, you know, been through a lot in their lives. What have you learned from your seniors, the clients you're working with, about how to enhance your own resiliency and get through times like this?
You know,
Go ahead, Christine.
I just, was thinking about what Dr. Wiley said earlier, and I can't imagine this being more true, is that how do we come at this from a strengths-based perspective, even during times that are very challenging, very stressful? And yes, we have to be thinking about infection control and our most vulnerable, but we can never forget that at the end of the day, older adults, they need to be in the driver's seat for this work that we're doing. And I can't tell you how many times I have been personally reminded of that, and I'm glad I have, whether it was from my volunteers, whether it was from intentional listening we did to our members to ask, what is it you need? So this idea of doing with in partnership versus doing to, I think, is so critical. And, our population that we serve is really good at telling us what they want, what they need. And it's up to us, I think, to create that space to make sure that we're getting that feedback. I am thrilled at the fact that we can do so much programming in a virtual space. And you always hear sort of, Marcy, to your point around ageism, this idea that older adults don't like technology. That's just not true. And this is a perfect example that I learned how to do Zoom because of my volunteers. My volunteers taught me how to do it. My volunteers are doing all of our public facing events. So, it's really just making sure that we're giving folks that opportunity, right? To really remember our training, come from a place of strength, and give folks the opportunity to tell us what they need and what they want.
So I was just going to say, I think we are gaining some insight as to what life is like for older adults day to day, in terms of the, limited contact with others, looking forward to any kind of small outings, like whether it's, going to the grocery store, going to the post office, because there's not a lot of other engagement. Also looking at like idle time that needs to be filled. So I've said to several people, like, when they've talked about, I'm looking forward to, going to the post office or whatever. I'm like, yeah, this is kind of how their life is day to day. I think the other thing that, a big takeaway from this is that, there's so much discussion about mindfulness and being in the moment, and that's so important now. And older adults do that very unintentionally. It's not like they call it that or what have you, but they wake up every day just being thankful that this is the day that I have. This is one more day in my life, especially the older they get. And so hopefully, that's something that we can take away, is that especially in this time of certain uncertainty and that type of thing, where it's that much more important to be in the moment, because we have no control over what's going to happen tomorrow or next week or next month for that matter. And so that's kind of what I feel like are some of the takeaways of this experience.
Building on that, I think one of the things that I, heard from someone early on, I was doing a check-in phone call with someone, and I said, how are you coping with this? Or how are you doing? And she kind of like laughed at me and said, I've been through worse. And, it was sort of like, well, I don't really go out much anyway, so that's not tremendously different for me. And, she said, I've been through, many big events, and she's like, this is something different, but it's nothing outside the realm of what I've been through. I've lived through, wars and times of social and political unrest and, other health crises. And, it just sort of kind of, I think for myself, put a little bit of a reframing on the conversation that we're having. Is, yes, absolutely, we're checking in to see how people are doing and, how are we kind of coping. But one of the things that I think I heard from so many people was, it was not necessarily a coping of the isolation necessarily day to day. It was I'm worried about other people. I'm worried about my friends. I'm worried about my family. I'm worried about my kids who are struggling with job loss. And, I'm worried about my grandkids and how are they navigating school and college and all of that. And I think one of the things that I kind of have sort of thought about is just the empathy that many of our older people have for others. And in times of struggle, that it's like Christine was saying, asking what people need from us, is not always what we would assume, and that we are not also immune to having the people that we help and support providing support at times to us and learning from, because many cases we are younger than the people we are caring for, and they have a whole lot of life that they've lived, and a whole lot of experiences to share. And that's a great opportunity and a privilege to walk with someone at this point in their life.
Yeah, I would just add that the resiliency of the older adults that we work with was something that I didn't realize until now, about just how resilient they are. And we've had to put them through so many different changes. It seemed like every single day there was new rules. You can't do this, you can't do that, or we're changing this or we're changing that. And people seem to just go with the flow. And for myself, it makes you think about it. Well, if they're dealing with this okay, then I should be too. And definitely this pandemic taught me a lot about resilience, strength, and adaptability, and how far my rubber band can stretch. And I think I got it all the way across the room right now.
You definitely do.
Adaptable we've had to be, but all good things. Again, you have to look at some of those bright spots, and
Right.
and those things are definitely things that we can take from this experience for sure.
I agree. And I think, to sum up the answers from this question, what I've been thinking and I sort of jotted down is how critically important it is for us as social workers, as clinicians, as students, and as just people in the world, how we really need to reconsider the imposing restrictive narratives on the aging experience, on what it's like to be old, on what it's like to have COVID and be older, or what it's like to live in a facility, a nursing home, or what it's like to be a volunteer, what it's like to be in mental health, all of these experiences with all of your fields, for example, within social work and working with older people. Everyone probably on our call today has something in mind when we think of a nursing home, volunteer, we all have this image that comes right up. We can't deny that image that comes up for us. And so what I'm suggesting, I think all the speakers agree, is that we really need to shed away with that ageist, biased sort of, belief system that we've all kind of grown up with, and understand the nuances and how we can't impose these narratives, that we just have to be there to listen. And it's very much similar to what it means to be a social worker, right? That number one thing you learn on the first day of your MSW program, start where they're at. Who remembers that? Yeah, there's a whole book on it. So it's just so critically important, especially when we're working with this population, to not other them and to give them the space like all of our speakers have shared. So I couldn't agree more. And I couldn't be more thankful for you all sharing your experiences with the students on the call, especially today. So if none of the speakers have any more reflections about those questions or anything else they wanted to add, I'd love to open it up to our audience for questions, but I'll give the space for anyone to share anything else they wanted to add before we kind of move on.
We got a great one in the chat a few
Yes.
minutes.
I see it. I'm ready to ask it. Or Joe, you can ask it. Go ahead. Okay, so we'll move on to the question and answer period for our panelists. And just before, we have a wonderful question in the chat that we'll address. And for those joining us today, if you don't mind switching on your camera to ask the question if you can. If not, type it in the chat. Do whatever feels comfortable. And thank you so much.
can ask the
Just jumped
question.
on. I don't know.
Oh yeah, Sarah's actually here and we see her. Hi, Sarah.
Hi. So I come from a social daycare, and we are closed and we switched to a virtual platform. And there's so much fear about being in person and risking health. But my fear is that isolation is more dangerous. How do we balance the danger and risk of isolation with the risk of infection?
Great question.
That's a great question. And to me, when I hear that, I start thinking about ethical dilemmas. I think about safety versus autonomy. That's what kind of runs through my mind. And, you know, we have to follow the guidance that we're given from the Department of Health and the regulations and things like that. Those are something that we have to follow. And then in looking at that, you know, what can you do? Are there certain things in the guidance that are that can be like stretched a little bit, or is the language so strict that you must do this, right? So that's, first of all, being able to understand the rules and regulations that guide. You know, second of all, I think as the months progressed, we learned a lot about the virus and how it transmits, and we also got better supplies of personal protective equipment. So, you know, as of right now, every single staff member has to wear these N95 masks whenever we leave our offices. We have goggles that we wear when we're talking to the residents. That equipment, you know, is definitely keeps us safe and the residents safe. But it's a great question, and we're trying to navigate in this unknown territory because we know that isolation is not good. And people can argue that it's almost as good or worse than the virus. I'm not sure whatever kind of side of that argument you're on. It's a valid argument that to make. And I know that the people that I talk to and leaders in the field that I connect with are frustrated by it because we know that isolation is not good. And we have to do whatever we can to try to connect people. Recently, in several of our nursing homes, we've been able to kind of move forward and start to open things up a little bit. I can't explain how excited I was to see some of our residents eating in the dining room one day. You know, it was just such a great feeling, the smiles on their faces. Even though they were separate from each other, just the fact that they were out and seeing others like them, I think that was really great. So these little, and I think we have to celebrate those small moments too. That's really important.
Anyone else want to answer? Thank you so much, Marcy. Anyone else want to answer Sarah's question about balancing the risk of infection with the risk of isolation? And as we know, the dangers of being isolated. And truthfully, you know, this expands past being older. This expands, you know, and we've learned that through the pandemic, that we've all been susceptible to, you know, an increase in mental health concerns, et cetera, due to the isolation we're all under right now. But I just want to open it up to any other panel members if they want to comment on this.
Well, I just think we also have to redefine how we view like social connection. And so even though we're connecting virtually, you know, or whatever way, like it's still offering something. And it's the safest way. So, you know, I think that has to be, and I know even for myself, like typically with doing, you know, sessions with older adults, if they were not coming to my office, I possibly was going into their home. And, you know, there hasn't been, you know, any like kind of pushback in the sense of saying like, oh, you know, why aren't you coming to my house or anything like that? I think, you know, that connection even if it is, like via Zoom or what have you, has still been beneficial. So I think it's just, and I think that's for all of us, like we have to redefine what social connection looks like. This is this so different from being in person?
Absolutely. And I think that, I piggyback on both of their point, and especially Marcy was talking about self-determination. I hear a lot from, the seniors who reside in the community, and sort of balancing, as all populations and all ages are, about how do we balance, the need to connect with others, and wanting to go sit outside at a restaurant, and, one of the challenges that I've heard from some of my colleagues who work in more memory care type of settings is some of the challenges with trying to help remind, clients who have cognitive changes about understanding about masks and why we're wearing it, and kind of washing our hands and keeping some distance. And I think that that's kind of it's a tough gray area. And I think has to involve the conversation with, whether it's the client, their family, looking at what's going to work best for that person. Is being isolated just such a detriment, and they don't have any type of connection, versus is it worth kind of the risk? And I think that that's sometimes a very personal and family decision.
Absolutely. Absolutely it is. Yes. But everything that you all shared is good to bring into the discussion. And, I would say, just as a clinician as well, that there's no right answer. It's really, again, flipping back to the person-centered care and person-centered decisions that need to occur. So, there's another question a few questions in the chat that might pertain to. But Christine, we're ready to move on. I just want to make sure if you wanted to add any. Okay. Okay. So I wanted to see, I don't know if I see any hands. We have some good time for questions. So I'll read this one from the chat. Any of the panelists, this is from Annabelle, have experience with hospice care during COVID? Any reflection or thoughts about helping those engaging in hospice and end of life care?
So I don't have any direct kind of experience with hospice, but we had a number of colleagues who were providing care not only in facility settings, but during the peak here, we had one of our outpatient it had been an acute rehab center that we were in the process of selling, that we reopened strictly as a COVID unit that was palliative and hospice. And, I know that, that there were a lot of that it was a very emotional, very challenging for the staff that were rotating through that assignment. And, because we knew that the people who were being transitioned to this building, it was very much a palliative hospice-based type of approach. And it was very difficult, not only for the patients, but for families. And the staff. And I think that that's a larger conversation as we talk about self-care, all of regardless of what setting that we're all in, looking at the impact that we've felt in many, many ways. But yeah, absolutely. I wish I had more to kind of offer to that question. Maybe the others do, but pervasive for sure.
Mm-hmm.
We have hospice coming into our homes at this point, and I'm not sure. I'm hoping I can answer your question, because I'm not sure 100% what you're looking for. But I know for hospice care, we are allowing, and this is regulated by the government regulations, compassionate care visits. So families are allowed to come in and see their loved ones. So those are things that are happening. I also wanted to talk about a thing that we did here. We had a memorial service recently for everyone who passed, whether they passed because of COVID or whether they passed because they just happened to pass during this time. And we partnered with, Parker partnered with the VNA to offer this. it was actually a program that the VNA health group was offering. And it was a beautiful ceremony and a time to just reflect. And, each elder who passed, their picture was there, their families were invited, it was outside. And it was just, really, I think, helpful for the families to get the sense of closure. Staff was invited, so they needed that closure too, to talk about it. So if there is an opportunity to do that in your communities, it doesn't have to be this big drawn out thing, but if there is something to be able to do that, I think it's important to remember and to memorialize and to talk about it.
I think one of the things that was especially helpful for us in our practice at sort of the peak is my social work colleague in the practice, that at the end of every week, we would sort of do a call and we would do a little brief roundup of the people that we lost that week, the patients that we lost. And I think it was helpful for both, us in the office and also our physicians who were practicing in the hospital and in skilled facilities, and just a way to kind of connect and remember was very, very helpful.
Absolutely, because as we talk, in our circles and in our classes here at the School of Social Work and in our certificate, we talk about experiencing loss, and how even if we expect it because, for example, the person is older, the person, for example, in this situation is living with COVID and unfortunately is losing that battle, it's nonetheless an emotional, difficult, and painful experience, even if you're an older person. Generally speaking, being older doesn't always make you comfortable with death. So it's just very important to provide these opportunities to pay honor, like Marcy and Rebecca shared, and just to offer that support to people going through loss during their later, years. Absolutely. Monitoring some of the chat here. I'm sorry if we don't get to all of these questions. There are really good questions coming in, which makes me so excited. Check out the certificate program, students. I dropped the link, I dropped the PDF. You guys all should consider it. Okay. I wanted to ask, there are such good questions in here, but since we talked a lot about technology and the reduction of isolation through such efforts, there has been some chatter in the chat about access to basic things like internet. And I wonder if any of the panelists have had this experience with securing internet, or if there's any special programs out there. I know Christine mentioned a few, and we talked about the Grand Pad, and potentially the agencies on aging might have, grants right now for those types of services. But anyone want to jump in about acquiring these even more basic services like internet to our older folks that are living in the community or in, an assisted living, for example?
I mean, I think at least from my perspective, what I'm seeing is I'm not seeing anything like this sort of at a cohesive level across the state. I'm seeing this sort of done again from our experience, some of our age-friendly communities that decide they're going to go deep on this issue and maybe provide iPads to local residents. I think the United Way of, I believe it's Northern New Jersey, is doing some work in the space, but I'm really seeing this as kind of I hate the word patchwork. I feel like we use that a lot in kind of describing how we as social workers kind of pull all the pieces of the puzzle together. But I'm not seeing anything specifically at a statewide level at this point. Really, I see a lot of this happening with individual communities that are kind of taking this on.
Christine, the program that you had mentioned through the United Way, Northern New Jersey, they got a grant, but it's geared towards caregivers to help provide assistive technology like the A word or the G word into people's homes to help make the caregivers experience a little bit easier. And I believe it's only available for caregivers in Morris and Warren counties right now.
Okay.
So I did put the link in the chat too.
Yeah. There's a lot of really
There it is.
there's a lot of really amazing resources that are being dropped right in our chat. So everyone take advantage. As I continue to scan, if anyone has any more thoughts about, acquiring those services, it definitely is, I would agree, Christine, representing sort of a larger issue with respect to access, especially for our older adults, and geography has a lot to do with this as well. We're mostly, I would say, situated in New Jersey as a whole. We're sort of situated in a place that's accessible. But when we think about our more rural counties or more rural states, thinking about the isolation factor there is completely concerning as well.
I don't know how long term it is. I know Comcast is offering like $10 a month, no contract internet to families with students, but also people who are on Medicaid.
Okay. So that's a way to access some individuals living potentially in a low income situation. Absolutely. Just scanning through. If any student has a question that they want to ask as well that hasn't chatted, please feel free to raise your hand or just start speaking. A lot of our cameras are off, so I open the floor. Well, I saw a question. I'm just trying to get to it.
I saw a question somewhere about substance abuse.
Yes.
I can't find it.
That's where I was going. I couldn't. Here it is. It's Steve, one of my fabulous policy students. Hi, Steve. I think he might have to run, but it's a really good question. He asks about speaking to the problems of substance abuse among older adults, specifically during COVID times. I'm not sure if anyone has any experience with that.
The only thing I can say is I can speak from, some of my colleagues who work in our emergency departments at the hospitals, is that we've certainly seen people who are coming in for, falls and some of the complications associated with substance misuse, that are using a little bit more frequently. As well as, I've had more so in the past 6 months than I probably have ever had calls from family members who have been doing grocery shopping for their loved one and said, I never really noticed how much wine mom drinks, but now that I'm going grocery shopping for her, I'm picking it up more frequently and noticing that this could be a challenge for her. I think there's probably some more awareness. This has definitely been an issue for a long time. It's unfortunately, those of you who are interested in the addiction space, that, there's sort of like this misconception that addiction in later life is somehow like sort of comfortable. And it's like, oh, we'll just have that martini at noon. It's no big deal. But it's definitely a pervasive issue. And then you throw a pandemic and maybe some cognitive impairment in there, and that's a real fun cocktail. But I think we're seeing more and more people coming into the, acute care setting with complications.
One thing I just want to add on this topic, it's not directly in line with the question, but we talked a little bit about some of the services that have been expanded and some of this innovation around telehealth. And right now, you can also access mental health, substance abuse services through telehealth, which again, is a game changer, especially in this space. So just wanted to make sure folks were aware.
Absolutely, it is. And for folks who don't want to do telehealth with video, phone calls are definitely something. We've had helplines and telephone-based social work forever, for decades. I was actually a helpline social worker, so I know it. But it's opened the space, as Christine mentioned, in terms of sort of like maybe shedding away a little bias about mental health across all ages of clients, right? There's more anonymity. There might be more comfort in sharing. And so it's definitely an opportunity for our students on the call to take a look at some educational learning opportunities. I know the field departments are putting out some webinars about this, so definitely take advantage, check in. Specifically, Newark Field Department has put out some telehealth training to get some hours. But it's so critical, I think, just because now that we know it works and we have more proof, even more proof than we did before, why would we get rid of it once COVID ends, right? Why would we? And I love the comment about the grocery store. I cannot stop thinking about the grocery store. Dr. Robin, you mentioned the senior hours. Why don't we just have them forever? I cannot stop thinking about that. That is all, it's been on repeat in my head. Thanks, Steve. Yeah, any other comments or questions? Check. Reading through. If anyone has any questions for the panelists, please feel free. There's some really great resources. The United Way Caregiver Support, it's right there. There's the Senior iPad Lending Library. There's a lot of opportunity, but we, certainly always need more and more discussion and more really good ideas.
I have a question. Hi, Dr. Lauren. I wanted to see what the panelists' thoughts were on, I know someone had touched on this earlier, but in what ways you think that facilities or like places like assisted livings and nursing homes could better support their staff during times like this, especially when it comes to grieving, because, not only are we not, I know that you had said that we recently just started recognizing the importance of those roles. But then I also think that we need to think about how they grieve too. Like if you're working and you're working with these people on a daily basis, grieving becomes like a very important part of that job, especially now when it unfortunately is happening a lot more than it might normally happen. So I wanted to see what your thoughts were on that.
So I'll answer this. So we actually started a program here at Parker. I'm calling it Healing for Healthcare Heroes. And we're starting an initiative. We started off pretty small, but we knew that we needed to do something. Yeah, A, for the grief, you're absolutely right. That is a huge part of it. And also B, for the compassion fatigue that we've discovered based on having to work differently in this COVID setting. So with that being said, we are dedicated to providing some groups, and we would like, our goal is to have each employee attend at least one group session. And we're calling it a well-being check-in. And because we have a lot of great resources here at Parker for our employees. We're a great organization. We do have the ability to do EAP services through our health benefits. There's a telehealth number that you can call. But my fear was that people aren't going to pick up the phone. I know the employees that we have. Some will, but most won't. And so we wanted to make sure that we made sure that we made our employees understand that their work is crucial and important. And in that respect, their mental health and well-being is important, because in order for them to take care of others, you need to take care of yourself. And that's basically the message that we're trying to portray. So in the well-being sessions, we introduce them to journaling. We introduce them to just answering a question like, how are you doing? And kind of digging into that a little bit. And at first, everyone's a little not sure why they're there. But then afterwards, most of the people say they were really glad that they attended. I remember one person said, I was really nervous going in. I didn't really want to share my feelings. But in the end, it was like drinking a warm bowl of chicken soup. That was literally what she said to me. So, so that's one thing that we're doing. And I'm partnering with a student actually who's helping us with it in a virtual way. And she's putting together all kinds of information about self-care. She developed this PowerPoint presentation for self-care for the fall that we're going to be distributing and putting out on our employee bulletin boards and things. So we're really using the next year to really focus on the mental health and well-being of our employees, because we really feel like that is really important, and it's a key factor to making sure that our residents continue to get the high quality care that they deserve.
I absolutely echo what Marcy has said. I think that anybody who's working in a, you know, kind of a direct, where you've been exposed to people who are living through this, you know, is, you know, there's lots of, you know, emotions that I think we're holding for families, for patients, for each other. You know, as well as all of us and the new stress that we all sort of are experiencing in just our day-to-day lives. You know, if you find yourself working with an organization that has those kinds of supports, that's great. Sometimes that's the opportunity. If you're in a small organization, you aren't necessarily, you know, don't necessarily have those resources to pull from. And maybe that's where you can sort of be helpful in an organization to say, what can I do and bring to the table to help talk about self-care? I just saw, was Joe, you said that, you know, absolutely that, you know, healthcare workers, doctors are not necessarily trained to do self-care. It's interesting. Part of my role is that I work with, you know, some of our residents and, you know, our fellow, and, you know, having this conversation, you know, about the psychosocial aspects is like, it just blows their mind, because it's just not something that they even consider. It's about medicine and dosage and diagnosing, and that's just not the realm. And I think so many times that we aren't going to see the effects of this for quite some time. Because all of us, Marcy, you said you feeling kind of like a rubber band, you know, and I think all of us are sort of feeling that way in one context or another. I just was talking with someone earlier today and said, it's kind of starting to feel like May or June again. You know, as we start to see a little bit of an uptick, you know, we're not quite at April, but we're kind of sort of feeling like we're getting back in that kind of ballpark. And I think that, you know, it's just a sense of constant stress, and that takes a toll on all of us. And if you have resources, great. If not, we have to find the opportunities to create them. And that's a really, really great question, because this is, and I think is in healthcare, you know, been in healthcare for a long, long time. And, you know, we're often very good at caring about other people and really not so great about trying to take care of each other.
Well, and I think too, in healthcare, and I'm not a clinical social worker. My background though is in long-term care, and you know, my experiences have always been that typically in healthcare, you sort of have these like acute peaks of stress, right? You have, you know, I mean, one of my probably the most stressful experience was evacuating a nursing home during Irene when it was flooding, but it's this defined period of time, right? And as healthcare workers, we sort of push through because, you know, you come out on the other side and then you kind of can usually take a little time to decompress. This is different. I mean, this is that, you know, we're 6 months in and it's just this constant slow burn. So I think to some extent, we're still figuring out what this is going to mean for folks in terms of their resiliency, because it's not that typical spike that you usually see in a healthcare situation, where most of us are in a way trained a little bit to deal with that. I mean, you know, in my career, I've never gone through this before, and most of us are in that position.
Yeah, I think you brought such a good point up, Christine, in terms of like the duration, because I was just thinking about all these other sort of disasters that have happened in our world with respect to all the hurricanes, Sandy, Irene. You can maybe, if you're like me, you can see the image, I think in Texas, of the nursing home with the older people in the wheelchairs with water up to their bellies. Yeah. So I just wrote down, like, why haven't we learned? Why haven't we learned? Not to say that we always will be learning about interventions working with older people, just as any aged client want to make that clear. But, from a policy perspective, as Christine adds, and also from healthcare perspective, and even one-on-one, we have to continuously remember these things and not just say, oh, we got through it. And that is the unique challenge of COVID-19, is that there are experts are saying it's always going to be around, which, is a new normal, yes, but we have to be prepared for surges of emergency response for older people, and also the care of those doing the hands-on work. Actually, just to add very quickly, one of our fellows, we have fellows as part of the Aging and Health Certificate, where you can apply and you receive scholarship money, and it's a wonderful opportunity. One of them is researching the long-term impacts of first responders from events like 9/11, and how that has, because they're aging, they're older, right? Like we all age if we're lucky enough. And so the mental health of first responders and the PTSD that they live and the trauma that they've lived through, and now here they are, potentially, we'll say 65 and older, coming to you for session, and they're talking about, pulling people out of rubble, just to be honest. And so, we have to think and invest in our workforce. We have to build our workforce, and we have to continuously invest in it. Again, self-care and education and just connecting with each other. So let's continue to take advantage of that, of course. Absolutely.
I think there's also a component of this that also we talk about vicarious grief.
Yes.
Right. That, we are not just necessarily experiencing it ourselves. Like I think Christine and Marcy, you're talking like, you have a bad week, right? It happens. We're sort of used to that, but this has been a bad several months, and every week is different. And, look, if you're working with older people, that you're going to experience the loss of an older client. That's just sort of the nature of the work that we do, but in a day, maybe you lose one. This is losing several. And that takes a toll. Like, it's not just necessarily a toll on your own experience, but also working with, the families and, holding their grief and each other and your coworkers. And I think that that's an important part of, yes, it's self-care, but also learning how to manage grief and live with the chronic sort of sorrow that sometimes this type of work, and especially a pandemic, has brought to light.
Definitely. And, again, thinking about those clinical opportunities and ways that we can obviously and always create change is definitely something I know all the panelists are excited to remind you all, on the call, and to consider working with older adults. And also, I always like to tell my students, even if you don't plan on working with older people, you're likely to, come across an older client in your practice, because we're all living longer, thankfully, and even despite COVID. And it's really important, just as we stress, the importance of knowing life development and attachment during infancy, we have to understand what it's like to age and what it's like to be older, and the experiences that are uniquely being carried out by our clients and our communities. So I think
and ourselves.
See, I forgot myself already. See, this is self-care. Self-care is very important. Very important. Don't forget yourself. So we are officially at 5:29. I'm so glad. You're welcome, Hannah. I'm so glad that everyone was able to attend. Thank you so much for our panelists for sharing such insightful information and experiences. It was just so wonderful. Round of applause and snaps for them. If we were in person, I'd have some swag for you. But I just have my praise and my thanks.
I have my Rutgers School of Social Worker mug from our last one.
I have my red glasses. Yeah. Wonderful. We're getting all really amazing feedback in the chat. We're so very thankful for this group and for our panel speakers. And unless anyone has anything else they'd like to share, I guess I'll go ahead and end our meeting for today. Okay, this was so informative. Thank you. Great. I'm so glad. All right, everybody. I think that's the end of our program today. So again, thank you, panelists. Thank you so much. And I hope everyone takes care, stay well, and have a good evening. Thank you all.